Hi, thanks for joining me at Student Nurses Success, where today we're going to talk about HIV or Human Immunodeficiency Disease, also known as Human Immunodeficiency Virus. Remember, you can find a link to the maps in the comments section. Let's go ahead and get started. I'd like to first talk about the etiology and transmission. The etiology or the cause of HIV is a virus. Specifically, it is an RNA retrovirus. An RNA retrovirus means that the virus actually converts its RNA into DNA once it's inside the host cell. Now, the transmission of HIV is through blood and body fluids, and it is considered a sexually transmitted infection. Standard precautions are used for HIV prevention. Standard precautions are really based on the anticipated exposure, and they're used to reduce the risk of transmission if you're being exposed to blood or body fluids. So, for example, if you're changing a dressing and you may have contact with body fluids, you would maybe use a gown if it was a big dressing change, and you would definitely wear gloves. If you thought that you were going to maybe get sprayed or exposed to body fluids, you may include eyewear or masking. So, really, what standard precautions mean is that we leave it up to you in order to choose which type of protection you think you're going to need in order to reduce transmission through blood and body fluids. Note that with HIV, casual contact does not spread the disease. So, shaking the hands with someone, as long as there's not an open wound on their hand, would not be some way to contract the disease. So, casual contact just doesn't spread it. Let's move. Let's move over to the pathophysiology. When talking about the pathophysiology of HIV, HIV enters the body, and once it enters the body, it binds to CD4 receptors. And those CD4 receptors are on your T cells. Once integrated into the host cell, the actual HIV virus will replicate and destroy the host CD4 cells. Now, if you remember, CD4 cells are called T helper cells. And T helper cells help communicate and call for help in the immune system. They usually call the CD8 killers, and they will also talk to the B cells in order to produce antibodies. So, as more CD4 cells die off because of the HIV virus, we start to have this missing link in the immune system that no one is calling for help. So there are less signals in the immune system and less communication. And therefore, the CD8 and the B cells just don't respond. Now, the virus is relatively weak outside of the body, so it does not live long on surfaces and it's easily killed by normal household cleaners. We also know that there are low titers in saliva, urine, and feces. However, that does not mean that you should not wear gloves or protect yourself because those are still considered bodily fluids. Let's talk a little bit about diagnostic and lab tests that are important for someone who is HIV positive. If you suspect that you're HIV positive or someone is HIV positive, one of the first testings they do is antigen antibody testing. Antigen antibody testing is usually relatively cheap and you usually get a fairly quick response. However, it is not highly sensitive and highly specific. And for something such as a diagnosis of HIV, we would definitely want to confirm that. And so if that comes back positive, we would want to do a more sensitive and specific test called the Western blot. The Western blot's more expensive and it does take longer to get a result, but it is the confirmatory test. Now, also remember that if someone suspects themselves of having HIV, it can take up to 6 months to produce antibodies that can be detected in testing. So if someone was exposed yesterday and they want to test today, they're not going to have antibodies and they're going to come up negative. That's not to say they can't test today. However, it's just not going to show if they were exposed yesterday. And again, it can take up to 6 months. Usually it's several weeks to maybe a couple months, but it could be up to 6 months. Now, infants who are born to mothers who are HIV positive, they present a unique situation because if you did antigen antibody testing and pulled their blood for that, you would actually just be detecting mom's antibodies, which would be positive. However, it is not for sure that an infant born from a mother who's HIV positive will have HIV. So sometimes they may do a viral culture and try to culture out the virus, and other times they just need to wait several months in order to really get definitive testing to see if the baby did, in fact, have antibodies. Another test that is helpful in HIV is something called a viral load. A viral load indicates the level of viral replication. So if the viral load is high, or if someone has an increased viral load, that means that the HIV virus is replicating fast. What we really would want to see is decreased viral loads. If we had decreased viral loads, that means that the virus is just barely replicating. So it's slowly replicating. And certainly, there is no cure for HIV, so we want to slow its replication down as low as possible. So we're really striving for decreased viral loads. The other thing that is helpful is monitoring CD4 counts because we do know that once CD4 counts get to less than 200, then we've moved into acquired immunodeficiency syndrome, which is AIDS or the end stage of HIV infection. Let's move on to manifestations. There we go. So, manifestations of HIV. HIV is systemic. It affects all cells in the body and it really takes its toll on every system. What we see with HIV is that it does have this affinity for mucosal cells of the GI tract. And you don't suspect that so much, but individuals with HIV really have a lot of diarrhea. They may have some malnutrition and weight loss. And those seem like very vague symptoms, but I'm telling you, those are some of the main symptoms and probably some of the more difficult daily ones to deal with. We also know that individuals, as their CD4 counts decline, are going to be at increased risk of opportunistic infections. And in fact, once they start contracting opportunistic infections, they've usually moved into the immunocompromised status of AIDS. Uh, Opportunistic infections can include fungal infections, CMV, parasitic infections you wouldn't normally see in most healthy immune systems, Kaposi sarcoma, and PCP, which is a certain type of pneumonia that is just uncommon in the healthy population. We see increased risk of pulmonary infections, pneumonias, fungal infections in the lungs, positive lymph nodes, mucocutaneous infections such as HPV or HSV, yeast and fungal infections in the body as well. Neurologically, as HIV advances, we can see neuropathies developed and encephalopathy in our end stage of AIDS. We see individuals with an increase in cardiovascular disease. A lot of this is related to the medications they have to take to control and keep their viral loads down. We see increased risk of cancers, specifically lymphomas, development of endocrine disorders such as diabetes and something called lipodystrophy. Lipodystrophy is kind of this movement of fat tissue into areas that are abnormal. So individuals take on a unique shape. We see renal and liver disease and failure over time, and in general, fatigue, generalized pain, and oral sores. We'll talk about disease progression here a little bit. I've kind of broken this down into three stages. I'm not sure really if there's stages, but three periods maybe is a better way to say it. The first is acute HIV infection. At the time of acute infection, there are no symptoms. So, the minute you're exposed to HIV and you contract it, you may not have any symptoms. You actually do not develop symptoms for a couple weeks. And that's when that seroconversion to detectable antibodies happens. And during that time, that can be anywhere from 3 weeks to 6 months after you contracted HIV. Patients may have flu-like symptoms, positive lymph nodes, fever, fatigue, sore throat, or they may be completely asymptomatic that whole time. The next period of HIV is the chronic stage or this latency period. This latency period can last for years. It can last a few months or it can last for years. During this latency period, we have seeding of the lymph and viral replication, and we just start to see this reduction in our CD4 counts over time. But individuals may not really have any symptoms during this latent period. However, if they do know that they're HIV positive, they can take medications to really slow down that viral replication and really spread this latency period out, really, I mean, 20, 30 years or more. Our last stage is what we call acquired immunodeficiency syndrome or the stage of AIDS. And this is end stage. At this point, patients are very symptomatic and they're very immunocompromised. So we start to see the development of opportunistic infections, and the other defining characteristic is a CD4 count less than 200. So both of these define AIDS. Again, remember, viral load is an indicator of the progression and replication of the virus, and we want to keep that viral load as low as possible. Last, we'll talk about treatments. With treatments, we're really focused on maintaining those CD4 counts as high as we can and decreasing those viral loads as low as we can to slow down the replication. Patients take multiple medications. The medication regime can be complex. Manufacturers have developed some combination meds to make it a little bit easier, but there's a lot of medications or combinations of medications that individuals take. We want to reduce risk of infections and reduce risk of transmission. And there is something called PrEP, which is pre-exposure prophylaxis, which can reduce transmission to partners and other individuals. And there you go. We've completed our map on HIV. Remember to subscribe and like our videos so that you're up to date on all our new ones. Thanks a lot and have a great day.